In this month's TAC Tic Talk, we caught up with chiropractor and lawyer Dr. Richard Brown, Secretary General of the World Federation of Chiropractic, to better understand what kinds of things they learned from the pandemic, what new projects they have on the horizon, as well as any current developments that may be happening in any region around the world. Listen on to hear what the World Federation of Chiropractic is doing to coordinate education into the future. But what is new with chiropractic around the world? Is there anything that you really want to highlight?
Yeah, it's a brilliant time for the profession at the moment. It's a really exciting time for the profession. And of course, having emerged from COVID-19 and 26 months of the trauma that we've had to go through with all of that, everything seems new in chiropractic at the moment. Everybody's sort of emerging and everybody's coming back. And I think we're coming back better. You know, we're not just coming back, we're coming back better than we were before. I think this has been a time for us as a profession to sit and reflect and think about where we're going and what we're doing. So I think that we are going to emerge stronger as a profession. I think there's exciting times ahead for the profession. As an organization, we have had an exciting time. We've just had a meeting in London just last month where you will know that we have just elected a new board, but we've also elected a new executive. And so our new president is Dr. John Maltby, very experienced chiropractor. You will know John. He is a past president of the International Chiropractors Association. He has been serving on the WFC board since 2015. So he started the same year that I started at the WFC. So we know each other very well and get on very well. And we're very excited about the energy that John is bringing to the executive and to the leadership. We have Kendra De Silva, who from South Africa as our vice president. We have Ryan Costa from Canada as our secretary treasurer. So that is our executive board, along with our past president, Carlos Ayers from Peru, and then I sit on that executive as well. But we've got a new board, and everybody's very excited about what's going to be happening. It's just an exciting time. There's just lots happening. I mean, we've got 7 world regions. We've got over 90 members. We very much focus on our policy, and in recent years, one of the things we've been doing is we've been doing it for many years now, but one of the things that we've escalated in recent years is our focus on diversity, equity, and inclusion. You know, we feel that is such a fundamental part of what we do in every policy that we put together. We do not do that in the absence of considering the whole DEI question. So that's really, really important to us. You may have seen our recent announcement. We've got a new public health committee, and that really reflects our diversity within the WFC. We have 8 members. We've got 5 women, 3 men. We have the First Nations Indigenous chiropractor from Saskatchewan, David Pies, who sits on our board. We're really proud of what we've got on our public health committee, which brings so much depth of experience to what we do. And, we've got lots of things in the pipeline. I mean, the one thing that we organize every year is World Spine Day, and you'll know about World Spine Day. You'll have heard about World Spine Day. October the 16th, every year. We have been coordinating it now for 16 years. Hard to believe, but 16 years the WFC has coordinated World Spine Day. It's an international day of action. We believe it's the biggest single public health initiative dedicated to spine care in the world. It's not just about chiropractors, it's about anyone with an interest in spine care. The theme this year is Every Spine Counts, which pretty much reflects our focus on DEI, but it also reflects the focus on caring for your spine from birth right through to old age. And so we're very excited about this theme, and we want every chiropractor to get involved, because let's face it, if chiropractors can't get involved in World Spine Day, then who can?
I love that message. That's really from the roots of chiropractic. So sometimes it's hard for me as a chiropractor, watching these things around the world to really understand how the different regions interpret the profession. And that's why I think the job you guys are doing is so critical, and that there be an open communication. And, like Carlos, he has a kind of lineage with Carlos Ayers had a kind of lineage with his educational development. Now you got John Maltby, also tends to be more ICA historically oriented, from my understanding, right? From that segment of the profession emanating from the United States. But then it does seem pretty different than the European version that you see, just by my interpretation. Even though in the end we're all looking for patient health, right? Patient benefit. But I don't know. For me, as a member of the media, it's always interesting for me to see how these things interplay. And then from the regional leadership position with the CCELA that we're trying to bring on and get acceptance by, we're trying to be inclusive as you guys are, and not promote any specific agenda. You got a really political job there.
It's what makes my job interesting, and I think because it is a global job, it behoves us to be globally aware and to be culturally aware, because the expression that we hear a lot now is social determinants of health, and those are those economic, environmental, social, political factors that impact on how health is delivered in every region around the world. So, chiropractic, how it fits into the healthcare system in Africa, for example, is a different framework than how it is in Europe or Eastern Mediterranean or in the Pacific region. So we have 7 regions, and we have to be conscious all the time that we are culturally aware, that we're culturally diverse. It's super important that the people that serve on our board and on our committees represent the community, represent the global community of chiropractic. It would be totally wrong to have a board and committees that were all of a certain type or all held a certain fixed view of a certain area. We need diversity. We need equality of opportunity. We need to be inclusive in the way that we operate. And we need to live that. It's all very well having words and having policies and everything else. But at the WFC, I'm really keen that we don't just have words and policies. We actually live and do what we say we're going to live and do. And that's reflected, I think, in our mission, our vision, and our principles, which set out what it is we stand for.
Well, that's important, ethically and in generating credibility, and not only within the profession, but between the professions. So I'm glad to hear that, Richard. So what are some of the plans that you have for the upcoming years then? With this new leadership, do you see it going in a different direction? Is it very consistently aligned with what previous leadership has done?
Well, I think that, the stability of an organization means that regardless of who the leadership is, we have a direction of travel to go in. And what we've done very definitely over the last few years is develop what we stand for, what is our vision, what is our mission. So regardless of who the president is, we are heading in the same direction, and we're heading there together as a group. Our vision is very simple, and so is our mission. But our vision for the WFC is a world where everyone enjoys universal access to chiropractic so that populations can thrive and reach their full potential. We think that's something it's easy to remember. It articulates what we're here to do. And our mission really builds on that. And that's to advance awareness, utilization, and integration of chiropractic internationally. So basically, we want more people to be aware of chiropractic, more people to use chiropractic, and for chiropractic to become integrated into people's healthcare teams. So as part of health systems, not to be subsumed by other professions, but to stand there as an independent, discrete profession that can work with others. And this is where our Be Epic campaign comes in as well, evidence-based, people-centered, interprofessional collaborative. I'm happy to talk about that. This year represents 25 years as a non-state actor in official relations with WHO. And we have never been more involved and more engaged with them than we are now. We've got the benchmarking project that we're working with. We're working on becoming a member of the World Rehabilitation Alliance. We're already a founding member of the Global Rehabilitation Alliance. And that's actually being, the WHO has been so impressed with the work that they're doing that they are now taking it in-house, and it's going to be the World Rehabilitation Alliance. So We've applied to be part of that. We were asked to become part of that by the WHO, so we've submitted our application. So that's going to be an exciting thing. We're working with the Decade of Healthy Aging because clearly we've got an expanding aging population. I think one of the golden opportunities for this profession is in helping older people to enjoy happier, healthier, more active lives. I think that is a absolutely nailed on a potential for our profession where I think we do well, but I think we need to do better at that. Rehabilitation, that's another area that we need to work on. Historically, people have thought about rehabilitation and thought about people just doing TheraBand exercises and that's rehab. It's not. It's about helping people to function better. And the whole rehabilitation agenda really feeds into exactly what chiropractors have been saying for the last 127 years, which is we need to focus on function, improving people's functioning, their lifestyle, how they interact with their environment, how they become active members of society. That's what rehabilitation is, how we get people from where they are to where they need to be. We know that low back pain alone is the biggest single cause of years lived with disability. We know that neck pain is number 4. We know that other musculoskeletal disorders are number 6. There is a massive opportunity for us to improve people's lives through chiropractic. And I think that we need to seize that opportunity. So we're looking at that. We're looking at, if we're working with groups, we need to provide data. So the other project that we're doing is what we call a global observatory for chiropractic, which will be a dedicated facility to gather information about what's happening in the profession. We do legal status surveys, we do other surveys, but we want to bring that together as a repository of information, similar to what NBCE does with their practice survey in the US. But we want to do this on a global level and really identify trends, because if we can identify trends, we can be a bit ahead of the curve. We can decide and determine what needs to be done, whether it's in education or in practice or in research, and really get involved in that. So lots and lots of things going on. One of the things that John Maltby is really keen on is our humanitarian work, looking at underserved communities, particularly in Africa. At the recent meeting, the board approved a project so that we will look at how we can work with the African Federation to help support and develop chiropractic in Africa. And just as an aside, in Africa, 54 countries, 1.4 billion people in Africa, 800 chiropractors in South Africa, and fewer than 50 chiropractors in the rest of the continent. So that really sets out the disparity, the inequity, and when you've got 75,000 chiropractors in the US and fewer than 50 chiropractors in the continent of Africa outside South Africa, that really sets out the need. And the figures aren't much better in many other parts of the world either. You take the Eastern Mediterranean region.
And they've even got schools in South Africa, right? According to
there are 2 schools, University of Johannesburg and the Durban University of Technology, DUT.
Yeah. Very interesting. No, this is awesome. So, all right, can you tell me a bit about the WHO benchmarking process? It's kind of a mystery to me. Like, I know it's 20 years, it's a different landscape. Educationally, you've got to be preparing for what's coming online and differences in interpretation of, and the meta competencies and whatnot for educational development. So, what is that? Have you been asked to do it? Are you doing it with other people? How much money is it going to take? How are you going about the fundraising?
Well, let's go back to 2005, first of all. The WHO published the guidelines on basic training and safety in chiropractic.
Right.
That was the first WHO document ever published that was dedicated to chiropractic training. It involved 160 reviewers from 54 countries. It was funded at that time by the government of Lombardy in Italy. But it was 2005. And as you know, with guidelines, every guideline has to be reviewed. It evolves. Evidence comes out. We know far more about safety of chiropractic manipulation now than we did 17 years ago. So there is definitely a need to update it. And we have been having conversations with WHO for the last few years, but the hurdle for us has always been the funding. because we don't any longer have the funding from the government of Lombardy. We have to raise it ourselves. And basically, WHO says, yeah, we can do this project, but you've got to pay for it. And so, we are having to raise the money to do it. And we've been very blessed in that we've had some generous donations to date, and we hope that they will continue, because although we have, we know what we've got to raise, there's also, on costs. There's additional costs for bringing people into Geneva, for having meetings, for organizing meetings in Geneva. And all of those things cost a lot of money to get people in, and fly them around the world to do this sort of stuff. So we're looking to raise funding to do that. But what are really benchmarks? Benchmarks are the new term that WHO uses, because it no longer uses the term guidelines. It uses benchmarks. We've got to look at the various parts of the world and what are the minimum requirements that a chiropractor needs to be safe and competent. Because ultimately, those are the things that you'll be familiar with your CCELA work. What are the competencies? Yeah. What are the things that we need to be assured for the benefit of patients, but also for the reputation of the profession to stay intact? What do we need to set out? And the guidelines set those out clearly. They had various groupings depending on how established chiropractic was in an area, and there were various levels of training that were set out there. So what we're looking to do is really set out an updated version based on new educational theories and methods and techniques. I mean, we're moving so much more now in the world of healthcare education towards competency-based education. And, you'll be familiar with that expression. I mean, that seems to be the direction of travel now for almost every educational program. So, it's moved away from numbers of hours of bums on seats to what are the core competencies that we expect graduates to be able to display when they graduate as chiropractors in order to provide safe, competent care. So, there are things that have changed. So this is what we're looking to do. We have helped, we worked very hard over the years to cement our reputation with WHO. We have good contacts at WHO now. Now, obviously, COVID has somewhat derailed the speed of the process, and that is a frustration for us. But next week, I have a conference call with the head of the Integrated Services Department at WHO, where we will be talking about how we can expedite this process and get the show on the road, because the connections that we've had have had other issues to deal with as a consequence of COVID. So we're looking at speeding up the process, but everything is on track, everything is in place, and we're very excited about the potential. We think it's going to help to again cement the reputation of the profession, but also help to protect patients. And what we found with the guidelines, it can be a fundamental foundation piece for the regulation of chiropractors, legislation around chiropractic, because what it does, it sets out very clearly what chiropractic is and what it isn't. Because we go to parts of the world and chiropractic is treated as a technique as opposed to being treated as a profession. And you'll know from some of the stuff going on in Latin America. You've got physiotherapists, saying that chiropractic is a subspecialty of physiotherapy.
It's interesting. It's irresponsible the way some of these people go about it, and it's unfortunate, but it's just the world we live in, right? We're in Latin America, and even all the way back to some of the bone setters and whatnot, and the history and tradition. So, but yeah, it's a brand is what I've struggled with it, the position I should have, honestly, because you see people just changing the name and then mimicking the techniques, and then but it seems like that's not enough to ensure security. So the benchmarking process, I think, is a great effort, especially from a branding standpoint for the profession. But I'm not sure it goes far enough for the security.
And it's important. I mean, the important message is that the WHO recognizes chiropractic as a distinct profession. That is the key message, and that in itself has tremendous value. It will help a lot of organizations in many parts of the world who struggle against this issue of people saying, well, I do chiropractic, or I'm going to give you some chiropractic. Well, we're a profession. We're not a treatment, and the trouble is that, and that happens even within our profession. I've seen organizations, chiropractic organizations, who've written definitions that have said chiropractic is a technique. We're shooting ourselves in the foot as soon as we do that, because we're just opening the doors to physiotherapists and others to say, well, we'll have a bit of chiropractic as well then. And that's just suicide.
Yeah. Well, it is, but it's like, so, it wasn't designed initially to become a profession as much as just to allow a guy to practice, right? to practice medicine without a license, to become licensed. But here we are trying to make it work, right? So, all right. Well, tell me about the International Chiropractic Education Alliance. What, if you're free to talk about it, or did you want to introduce it at your seminar and then talk about it?
Well, we're going to be launching it. We're going to be talking about it coming up, but it's going to be officially launched in at the education conference. But what we can say now is the International Chiropractic Education Alliance, or ICEA. It's all about promoting high standards of chiropractic education. It's a global forum for discussion, to bring people together, to whether they're stakeholders or institutions, to share best practice, and also to help create consistency across the chiropractic education worldwide. Because one of the things that is that chiropractors in some parts of the world look completely different from chiropractors in other parts of the world. And what we're not looking to do is change, the identity of individual chiropractic institutions. We're not looking at creating clones, because that doesn't happen in institutions. You look at the UK, look at Oxford, Cambridge, University College, Imperial. They're all highly regarded universities, but they all have their individual focuses, whether it's science or the arts or other areas. What we're looking to do is create consistency so that public really has a better appreciation of what chiropractic education looks like. What are that we insist on high standards of education, and also it helps those institutions who are emerging to learn from those that are established. And so by creating this umbrella global alliance, we feel that we are perfectly placed as the WFC to be able to launch this organization and really help to develop the profession worldwide through education, because education, quite frankly, has to be the very foundation stone upon which everything else is built. Because if we don't get education right, as a profession, we lose credibility, our reputation suffers, we go nowhere.
Can you tell me, what are the dates of the Logan seminar? What kind of attendance do you expect? Is it by invitation only, schools? Can general chiropractors go?
We're really looking forward to the education conference at Logan University. The theme is creating consistency. It's leveling up, creating consistency in chiropractic education. It takes place at Logan University, November the 2nd to the 5th. All are welcome to attend, although it's generally of interest mostly to chiropractic educators and those with an interest in chiropractic education. So we have institutional leaders, we have faculty, we have students and student organizations, we have educational researchers, we have national association meetings. And one of the things that we've really pushed in the last few years is that national associations should send their leaderships to the education conference, because it's so critical that they understand what is happening in the world of chiropractic education. And by not understanding that, how can they run an effective national association if they don't understand what's happening at their very grassroots education, or what the profession might look like in 10 years, 20 years time? Because knowing about education helps you to identify trends. It helps you to identify other parts of the profession where we need to plan. We need to be thinking about how chiropractic education is delivered, and what are the new innovations in healthcare education generally that are relevant to chiropractic that we can utilize, and we can borrow, and we can develop. I mean, look at how teleeducation and remote education has evolved. That has evolved hugely. Now that in itself presents lots of opportunities for the profession to deliver chiropractic education into remote communities, or into communities where people don't have the resources to move to a big city and live there full time for 4 years, but can come into the city to learn their practical hands-on work and then go back and learn in other ways. So these are things that we've seen. COVID has been a catalyst in many ways for the way that we deliver chiropractic education. And there are lots of things we can learn from it. We've seen what works well, we've seen what doesn't work so well, but it's been a massive experiment. It's been a huge catalyst. There's great innovations that have come out, and we want to showcase those at Logan, November 2nd to the 5th.
Now, what about you usually do a big bash around the world, right? Every couple of years. So where's the next one?
The next one, well, I mean, last year we were affected by COVID, and I want to give a shout out to Parker, because had it not been for Parker University, we were able to put on our event online last year. It's got to be one of the most professional setups, if not the most professional conference setup in the world at Parker University. They stepped in, they offered us all of their resources, and we were able to do an online seminar. Next year, 2023, we are back live in person, and we are going to be in Gold Coast, Australia. Who is not going to want to come to Gold Coast, Australia? It's going to take place in October the 11th to the 14th, 2023. The theme of the event is Let's Start with the Patient. So it's going to be all about patient-centered care. We think that this is a theme. It doesn't matter what type of chiropractor you are, what technique you use, where you practice in the world. Let's start with the patient is exactly where we need to be. And this is what we're going to be talking about. We're going to have outstanding plenary speakers. We're going to have brilliant keynotes. We're going to have inspiring panel discussions. We're going to have workshops. We're going to have research presentations. And of course, we're going to have social events. What is Australia without a Barbie? Gold Coast, Australia. It has to be one of the best places in the world to come to.
Outstanding. No, that sounds like a real perfect venue, perfect option for your first after the COVID pandemic, right?
One of the things we want to get back doing again, Joe, is our regional seminars. And pre-COVID, we did one in Singapore for our Asian region. We also want to be doing stuff in the Latin American region as well, to come in, because we had a seminar in Lima in Peru back in 2018, I think it was, when Elise Hewitt came down and did a WFC seminar for us on pediatrics. So yeah, we want to give people the opportunity to hear what the WFC's got to say, but also learn and develop and evolve, and really be part of our global community, because that's what we've got to be. We are all in this together, and we have got to be, as a profession, we have to be a global community. We have far more in common than the things that separate us. It's just lots of exciting things happening in the world of chiropractic, and I'm very blessed and privileged to hold the position that I hold. I'm very lucky, and I appreciate what I do every day as being something that I'm hugely privileged to do, and it's a blessing to be able to do it. Next month, I'm going back to Toronto for a bit. Then I'm going to ACC RAC in San Diego. Then in September, I'm going to the Chiropractic Association of South Africa conference in Cape Town. And then I'm going to the Cleveland University Centenary.
You're doing that, in October, right?
And then pretty much at the same time, I'm going to be at the Canadian Chiropractic Association conference in Montreal. Before we then kick off our education conference in Logan. And I'm sure there'll be stuff between now and then that pop up as well. I know I've got to go to Denmark, because we've already announced our 2025 WFC Congress. That's going to be in Denmark, celebrating their 100th anniversary. So we're planning well ahead down the road, and lots and lots of stuff going on.
Right on. Well, thank you, Richard. Thank you. And, enjoy your Friday. It's quite a way to wrap up. I mean, this is an important interview for us and for the profession.
I really appreciate the opportunity to speak to you today. Anytime I can be of assistance and help you in your mission and in your work.
Thanks for taking the time, Richard.